Hi, this is Dr. Silvester. I'm going to talk to you now for a few minutes about how you can stop suffering from neuropathy. I'm going to give you 2 things you can do at home and a few things we can do at the clinic that can really change your life and make your life a lot better. We hope this is a message of encouragement and hope to patients who have been fighting this terrible disease. We treat this all the time and we're very successful at it. So let's get started. First, why treat neuropathy? First of all, neuropathy has some terrible consequences. Decreased quality of life, depression, foot ulcers, amputations. In fact, overall, people that have neuropathy have a shorter lifespan than people that don't, because I think it's probably because of the other diseases that cause the neuropathy, but certainly neuropathy causes people to avoid activity, so that inactivity creates a situation where it becomes really a threat to your life. So it also can really damage your sleep patterns. We have a lot of patients that have very difficult time sleeping before we start them on their neuropathy treatment. Then once they start on their neuropathy treatments, then they are able to sleep and be a lot more comfortable. So here's a couple of things you can do at home. Well, first let's look at the causes, and then we'll talk about those things you can do at home. The causes in the United States, primarily diabetes or prediabetes, and then also what's called idiopathic. We see it a lot in patients that have thyroid dysfunction, even though they're being treated. Alcohol, there's a few people that have alcohol-related neuropathy. Vitamin deficiencies can cause it. There's also one of these ones that we have down here is nerve compression and spinal causes. We see this all the time. People come in and they say, well, there's nothing that can be done because it's in my back. And that is definitely not true in most cases, because the symptoms are much more severe by the time they get to their foot than they are in the back. So if that's the case for you, don't lose hope. There's some things we can certainly do to help you out. So let's go on to talk about, first of all, your diet. Diet has to be a critical part of any aggressive, thorough, and effective neuropathy treatment program. If you're eating terrible food and you have high blood sugar, there is nothing that's going to help you. We see this in patients in A1C above 7.5. If your A1C is above that, the first thing you should do is stop eating sugar and carbohydrates. If you stop eating sugar and carbohydrates, there are many, many clinical studies that show that significant neuropathy symptoms can be managed, especially in the early stages of the disease. There are 2 references that I would recommend to you. One is called The Sugar Crush by Jacob Jacoby. It's a book. It's very informative about how in the he kind of goes through the history of high fructose corn syrup. And when that became available, the incidence of nerve entrapments in the United States went way up. And there's lots of different kinds of them. There's like carpal tunnel syndrome, tarsal tunnel syndrome, Meniere's. I think there's one up here in the head that's a nerve compression of the nerve. And spinal nerve compressions can occur. And the incidence of those went way up with the advent of high fructose corn syrup because people were eating a lot more sugar. So anyway, if you can cut down on that and eliminate it, you can certainly do a lot to help your nerves. Next, this just talks about eating too much in general, which is kind of the same thing. Patients with your increased caloric intake, your risk of diabetes goes up, your risk of obesity goes up, your risk of the associated neuropathy with diabetes goes way up. This just shows the difference in calorie intake from 1955 to 2015. Apparently we're a lot more hungry now than we used to be. But anyway, that's a risk factor for diabetes. And the second source I wanted to refer to you is a video. It's a TED Talk by Dr. Robert Lustig, Lustig. He's a doctor at University of San Francisco. He teaches there, and he specializes in pediatric obesity. It talks about the effects of sugar in our diet, and it's great about how much more sugar we're eating now than we used to. And there's another one that he has. It's called Sugar, the Bitter Truth, and that one is talks about how sugar is really a poison. And don't get me wrong, as you can tell by looking at me, I use sugar. So anyway, it's something we all need to take a look at, and if you're suffering from neuropathy, that's a good place to start. Anyway, so the next thing you can do at home is nutritional support. There's a couple of nutritional things that are very effective. They're actually more effective than things like pregabalin or gabapentin or Lyrica or Cymbalta, things that, these are probably words, if you have neuropathy, you know, you probably are taking these if somebody's prescribed them to you. The problem with those drugs is, I mean, don't get me wrong, there's nothing wrong with feeling better, but the problem with those drugs is they don't do anything to help you get better or help you, they make you feel better because they just dampen the pain while your nerves die. These actually help the nerve get better. So alpha-lipoic acid, N-acetylcysteine, and acetyl L-carnitine. Now I'm running kind of through these a little quick, but basically all of them are antioxidants, and they also help mitochondrial function. Mitochondria are this gasoline station in your cells, so it provides energy. Why nerves are so sensitive to mitochondrial dropout, or mitochondria where they don't work well, is because they require 4 times as much energy as every other cell in your body just to maintain their normal function. So, ongoing, besides those, B vitamins, particularly vitamin B12, seems to be very effective for most people with neuropathy. It can be very helpful. Thiamine is very helpful, but the problem with thiamine is when you take it, none of it's absorbed, so it's better to take benfotiamine, and that is converted to thiamine as soon as it gets into your bloodstream. There's some others here. The one you want to be careful about is vitamin B6. If you get too much vitamin B6, that can also cause neuropathy. So anyway, you can look at this slide and pause the slide and look at it. So those are 2 things you can do at home. Stop eating sugar and carbohydrates so much, and then do some nutritional support. Literally, I'd say 20 to 30% of the patients that will do those 2 things get 50% pain relief with their neuropathy. I've saw it twice last week in my clinic. I had told these people about 3 weeks ago to do those 2 things, and a lot of them got better. Now we're going to talk about some other things.